we'll have a chance now to get into a real discussion around how we can think about restructuring both the way care gets delivered and paid for that actually enhances value, the cost, quality, and service over time, and a pressing question to be sure. To get into this discussion, to kick it around, we have, I think, two giants in the industry. Ron Williams, to my left, is the chairman, CEO, and president of Aetna, national health plan that has a great track record of innovation in products, including consumer-driven health, high-performance networks such as the Excel network, and the strategic use of information in healthcare delivery. And joining us as well is Denis Cortese, retired recently, CEO and president of Mayo Clinic, and now a professor at Arizona State University in the faculties of the business school and engineering. So, gentlemen, really, really pleased to have you here. It's a real treat. And I think perhaps what we'll do is just start out with a few opening prepared remarks, and then we'll get into Q&A. Thanks, Ron.
Very good. I think just a few opening comments. I think as we started down the whole process of healthcare reform, we initially started with the goals of focusing on access, quality, and affordability. And I think it's clear that while, according to the legislation, there's been progress on access, the whole area of quality and affordability really will remain issues and work to be done. And I think what we're learning from some of the experiments that have gone on in states like Massachusetts is that unless you get affordability right, long-term access is really hard to address. And the road to affordability really lies through quality. So I think there are really four key issues I just want to briefly comment on. I think one of them is that in addressing quality and affordability, the critical issue is going to be collaboration. It's going to be collaboration among health plans, providers, employers, hospitals, physicians, and consumers. And that's going to be a critical element of long-term success. I think there are four things we really have to do to address the issues of affordability. One is reforming how we pay for health care. The second is making certain that we're creating the right incentives, particularly at the primary care level. And that means taking a look at how we use all aspects of the primary care delivery systems, physicians, nurses, pharmacists, other healthcare professionals. And we'll get a chance perhaps to talk about that. The third issue, and this is one that I can tell you drives the business community absolutely crazy, is how we use health information technology in our sector. When you talk to CEOs who run major corporations who have fundamentally transformed their businesses and their industries through the use of health information technology, they cannot understand why health has not been able to apply similar principles.